Hi, my name is Madeline, and today I will be informing you of the effects of alcohol on the body. So how many of us have drank alcohol? Whether it be a sip or an entire six-pack, most of us have experienced alcohol in our lives. But most of us have not thought about the effects that it is having on our body as we are drinking. This is what I'm here to inform you about today. First, I will start off with what is alcohol. We will follow the path of alcohol through the body, specifically talking about the liver, kidneys, and nervous system. We will talk about factors that influence alcohol's effect at a low, medium, and high dosage. We will talk about chronic alcohol use, fetal alcohol syndrome, and what is a very important issue for us today is drinking and driving. But before we can talk about the effects of alcohol, we first must understand what is alcohol. Alcohol is the world's oldest drug made from fermented grain, which is beer, or fermented fruit, which is wine. It is also considered a depressant. A depressant is anything that modifies your bodily functions so they are not functioning up to par. The extent of this modification of bodily functions is dependent on 5 factors. Factors that influence alcohol's effect are age, gender, physical condition, amount of food eaten prior, and other drugs taken with the alcohol. You are more likely to be affected by alcohol if you are young, female, not physically fit, or have not eaten a good solid meal prior. Other drugs in combination with alcohol is never a good idea. And for example, medication for seizures, anxiety, and epilepsy have side effects including severe depression and suicidal thoughts. Many of these people have acted on their suicidal thoughts. Pain medications such as Advil, Motrin, and Tylenol, which most of us take on a day-to-day basis, also has severe side effects when combined with alcohol. For example, racing heartbeat, irreversible liver damage, internal bleeding, and ulcer formation are a few of the side effects when Tylenol, Advil, or Motrin mixes with alcohol. So you had a few beers at a party, hopefully not in combination with medication, so let's follow it through the body. It begins at the mouth and goes to the stomach and then to the small intestine. It is here at the small intestine that alcohol enters the bloodstream through little folds in the small intestine called microvilli. The blood then goes to the heart and is pumped throughout the body, going to the nervous system, liver, and kidneys. We will focus on the effect on the nervous system on the next slide, but here the liver and kidneys work to detoxify and excrete the alcohol from your body. When you're drinking, you are inhibiting a hormone called ADH, and ADH is responsible for keeping the water inside of your body. So when you hear people that say that they broke the seal, this is essentially what is happening. ADH is inhibited, so your body can no longer keep in the water, and all the water in your body is being expelled. So now let's talk about the nervous system. The nervous system is composed of 2 parts, the central nervous system and the peripheral nervous system. The central nervous system is made of your brain and spinal cord, and your peripheral nervous system is made of the nerves for muscle movement and sensation. Neurotransmitters are also a very important part of the nervous system, and 3 specifically are important when we're talking about alcohol. There is a decreased transmission of acetylcholine in your body when you are drinking alcohol. Acetylcholine is what makes your muscles move, so this is where you get the delayed reactions from. Your body also releases norepinephrine, and when drinking, this norepinephrine is increased. So that's where you get your rapid heartbeat from. And dopamine is also released, and it is also increased when drinking alcohol. Dopamine is released when you do something good. You're getting a reward. So it makes your body want to do it more. And this is how people get addicted to alcohol. However, the extent of these 3 neurotransmitters is affected by how much you drink. At a low dosage, the side effects are a relaxing effect, reducing tension, impairs concentration, slows reflexes, impairs reaction time, and reduces coordination. These aren't as severe as they are at a party scene, typically a medium dosage of alcohol. This is where you get slurring speech, drowsiness, and altered emotions. And you get your mad drunks, sad drunks, happy drunks, funny drunks, angry drunks. And if people sadly continue to keep drinking after they reach this stage, this is where you get the high dosage of alcohol effects. Vomiting, breathing difficulties, unconsciousness, coma, and death are side effects of high dosage of alcohol. These are very common in alcoholics and chronic alcohol users. Abusing alcohol doesn't only hurt you physically, it can also hurt the relationships you have with others, such as your family or friends. But physically speaking, abusing alcohol damages the frontal lobes of your brain. The frontal lobes of your brain are responsible for long-term planning, long-term decisions, and this is why alcoholics seem to be very unorganized and difficulty planning out their future. It can also cause a vitamin deficiency, which can cause irreversible memory loss, coordination difficulties, and they just continue to progress and get worse. And people who are alcoholics and are experiencing these symptoms are also at an elevated risk to have a child born with fetal alcohol syndrome. When a woman is pregnant, their fetus is fed through their placenta, which means the carrots and good things that they're eating goes to the baby, but so does alcohol. Alcohol disrupts the normal brain development of a child, specifically in their corpus callosum, which allows their left and right hemispheres of their brain to communicate with each other. This causes smaller heads and brains, some degree of cognitive impairment, poor coordination, hyperactivity, and abnormal facial features, as you can see in the child on the left. The image on the right shows two brains. The brain on the left is a normal child's brain, and the brain on the right is a brain of a child who has fetal alcohol syndrome. So, although fetal alcohol syndrome and chronic alcohol use are very important issues, what is more important to our age group is drinking and driving. The BIC limit in Texas is 0.08%, which means if your blood alcohol content level is above this while you are driving, you will go to jail. You can calculate your own BIC by the following equation: 150 over your body weight times the percent alcohol over 50 times ounces consumed times 0.025. For example, a 175-pound male who drinks 4 12-ounce cans of beer, say at a party, his blood alcohol content level will be 0.08%. So, it's bad to drink, that's what you're thinking. No, drinking in moderation is okay, it's a social event. Just do not drink when you're taking medication. Don't drink if your blood alcohol content level is high. That's all that people want you to know. And this brings us to the conclusion. What is alcohol? It is a small molecule that enters the bloodstream very easily. It is made from fermented grain or fermented fruit, and it goes through the body as your liver and kidneys try to detoxify and excrete it from the body. It has very substantial effects on your nervous system, your brain, and your coordination, and this depends on the dosage of alcohol. Low symptoms are not so severe, while high dosages of alcohol can lead to alcoholics and chronic alcohol use, fetal alcohol syndrome, and what is most important for us today is drinking and driving. That is something you don't want to do, or you will end up in jail, and it is just a mess and you don't want to go there. So I hope you've learned a lot of things that will help you to decide when you are drinking, how much you should drink, and what the possible consequences of your actions are. I hope you enjoyed listening. Thank you.